What makes you go to a psychiatrist conference if you are not a psychiatrist?
Well, I'm a neuroscientist,
Okay.
but I work in a field of neuroscience that is close to psychiatry. In fact, I work in a department of psychiatry at a university in Pittsburgh.
How close is the connections to the psychiatrists?
The type of work that I do is like experimental using animal models, but my work is in some way inspired, you could say, by the data from what is called post-mortem research studies. Meaning you could obtain material of brain tissue from patients that had schizophrenia or with normal control human brains, and you can study certain things about deficits or malfunction of neurons that you can see in what is called the post-mortem type of research.
So they are dead,
Yes.
and you take out pieces of the brain in order to do your research. So the patient, before he dies, does he sign for it, or is this the family who allows it, or who?
I think
How
it's
do you?
It's a combination. It's a combination. In some cases, it's the family.
Yeah.
I think most of the cases is the family. Yeah.
It's very difficult to find out, or I don't know what the basic research is in your field in order to prove that when you have some tissue from my brain, for example,
Yes.
so you can say, oh, well, this part of brain has this and this kind of damage, or if you have brain cancer, you can say that was. But this is more a psychological, or it's about thinking what's going on in the brain. So how can a tissue prove with the neurons? When it's dead, the brain is dead.
That's the job that we try to do, is to say a person that was known to have behavioral problems,
Yes.
a person that was known by doctors to have a behavioral problem, once we can study the brain post-mortem, what differences do we find in this brain compared to the brain of a normal, so-called normal person, which is what we call control.
Yeah. These patients must have been in a long process of treatment. So if
Yes,
this
in
treatment,
many cases, most cases, this is true.
so most of the times people take medication, different kind of tablets of medication.
Yes.
So now that person is dead, no matter what the result was of the treatment. Do you think the treatment with the medication
that's
is
an important point, I believe. It's like
the chemical?
there's a number of what is called controls, not sort of controls for potential effects of the medication. The question is, if we find some difference between normal brain and schizophrenia brain, but the schizophrenia brain comes from a patient that had medication, how do we know that the difference that we see is because of the disease, or because of the medication, or because of an interaction between disease and medication? And that's a very important question.
That's a big question.
In many cases, unfortunately, there is not a good answer for that. Sometimes you don't have a good answer. In other cases, you can do some measurements and calculate some numbers that will tell you, oh yeah, this is absolutely, this is not the disease, this is the medication. Or in other cases, you're not entirely sure. Or in other cases, you're more certain that the difference that you found between normal brain and schizophrenia brain is not due to the fact of medication.
So how does a schizophrenia brain look like in comparison?
Microscopically, only you find differences. It's different from neurology, right? So schizophrenia, let's say people that have Alzheimer's disease.
Yeah, that's a different topic,
It's
but
completely different.
Yeah.
So then,
but how does it look?
Schizophrenia is not like Alzheimer. If you just look at the brain, there's no difference compared to normal brain. You have to get a piece of tissue and put it under the microscope.
And what does the microscope show you?
Only then you may start finding some differences, for example, in the chemical composition of the neurons. The chemical.
That's a very detailed,
very microscopic, very subtle.
Interesting,
very
and
subtle.
a very difficult part of medicine, I think. it's interesting, also what's going on in different countries or what kind of treatment they offer, because the one doctor says here, for example, he wants more the electronic support of depression. The other one says no, that doesn't work. The opposite person says no, that doesn't work. You have to take my special tablet every evening. It will help you. So this is what's going on here. So,
I think an important point is like, from my perspective, is probably psychiatry, like any other area of medicine, is maybe not perfect. But the question is, are psychiatrists trying to help people? That's the main purpose, right? Like any doctor. And
your part is different. You do more kind of research. You are not the direct psychiatrist.
Exactly. As a biologist, I would think when there is a behavioral problem, the problem comes from brain. And we want to understand what is the problem of brain. For example, to understand why some medications actually that psychiatrists use, why some medications actually don't help the patients so much, right?
Yeah, maybe, often it's not a behavioral problem because of the brain, it's a behavioral problem because the social setting, the family structures nowadays are difficult for job reasons, for people have a divorce, etc. And this has an influence on the children, on the young adults. That causes many times behavioral problems that change later on. So enjoy your stay. Thank you very much, and I hope you will meet some good colleagues that have the same interests.